Assalamualaikum. My name is Nur Akila binti Muhammad Rosli. I am from MBSA 6A. Today I want to share with all of you basal cell carcinoma. Okay, let's start. Okay, BCC means basal cell carcinoma. It is the most common form of skin cancer in the United States. And it is researched by Davis and Kylan E. at 2020. Okay, I want to share with all of you, which is the picture or how it looks like of basal cell, squamous cell, merkel cell, melanoma. And this is one of the BCC that looks like. Okay, then, okay, what is a BCC? BCC is type of skin cancer that forms in the basal cells of our skin, and basal cell exists in the lower part of your epidermis, which is the outside layer of your skin. And then BCC looks like a small, sometimes shiny bump or scaly flat patch on your skin that slowly grows over time. Okay, I want to share with all of you. I am the one that faced with BCC. Yes. At the first time, I am not aware that I have the BCC, but I just think that it is just like a mole. Yes, like a mole. But my mother asked me to go to the clinic, have some checkup, and then the doctor at the clinic refer me go to the hospital. And then after some checkup at the hospital, I have to go to biopsy procedure. And the result came out with BCC. And until now, I have a checkup at the hospital because doctor want me to totally 100% free from the BCC. Okay, and it is for me. We have to always alert with our body so that sometimes it's like more, so we have to alert. Is if it is really more, it's okay, but if not, so we have to be careful. Okay, refer to Jack Fagan 2022 in article of basal cell cancer. The most frequent kind of skin cancer is BCC, which has a lifetime risk of over 20% in the US. Basal cell carcinoma account for 18% for all non-melanoma skin cancer diagnoses in the United States each year, according to estimated. All age groups have seen a rise in the number of diagnosed BCC at a rate close to 10% per year. And the increased incidence of BCC in younger age groups, particularly women, has been linked to an increased exposure to both natural and artificial ultraviolet light. Okay, type of BCC. BCC forms are typically categorized into 5 groups, which is nodular BCC, superficial BCC, pigmented BCC, morbid BCC, and basal small cell BCC carcinoma. Regarding an article by Uli Lin Marks on 2020 in Everyday Health portal, BCC may look like a flesh color, round, growth, a pearl-like bump, a pinkish patch of skin, and a bleeding or scabby sore that heals and then comes back. Okay, then, okay, for the first, nodular basal cell carcinoma, as previously indicated, basal cell carcinoma account for 18% of skin malignancies. These have nodular BCC in about 70% of cases. These lesions, which are most frequently observed on the head, typically have pearl-shaped nodules with telangiectasia on the surface. Melanoma and certain kinds of nodular BCC might look same. Look like this. Okay, next is superficial basal cell carcinoma. Basal BCC that are superficial account for about 20% of cases. Well-marked red plaque with a pearl-shaped edge and sectional erosion characterize superficial BCCs. They do not frequently spread invasively, so like here. And then we move to pigmented. There are various forms of BCC that exhibit pigmentations. Part of the lesion include pigments that are dark, black, or brown, so like this. And then we move to more heat BCC. There are unusual and have crimson plaque with a rough border and a slightly glossy finish. And then the last one is basal cell carcinoma. Fortunately, basal small cells is rather uncommon with characteristic of both BCC and squamous cell carcinoma. It is an aggressive cancer, and after eradication, it frequently returns locally, but it also has a high propensity to spread to distant areas. Okay, next, the BCC can be characteristic that to put the cancer of higher risk for metastasizing or recurrence. Example of features are thickness of more than 2 mm, invasion of the skin, lower dermis or subcutaneous layers, invasion of the skin, small nerves, and location on the ear or lip with hair. Okay, the stage 0, cancer that is seen this stage has not penetrated further into the dermis, and it does present in the epidermis on top layer of skin. Then for the stage 1, the malignancy has one or fewer high risk characteristics as less than 2 millimeters in size, 4 to 5 of an inch wide, has not spread to adjacent lymph nodes or organs. And then for stage 2, the cancer has not progressed to other organs except into the face bones or one surrounding lymph node. And the last one is stage 3. The malignancy may be of any size, have metastasized, spread to one or more lymph nodes larger than 3 cm, or have spread to the bones or other body organs. Okay. The risk factors of basal cell carcinoma, we can see that it's from the table shows that it's from the article BCC squamous skin cancer, early detective diagnosis and staging. Okay. First, the most common cause of basal cell carcinoma is ultraviolet radiation exposure, whereas squamous cell carcinoma appears to be strongly linked to cumulative sun exposure. The link between ultraviolet radiation and the risk of BCC is more complicated. Okay, the timing, pattern, and amount of ultraviolet radiation exposure appear to be important. Recreational sun exposure during childhood and adolescence significantly increases the risk of this disease. Instead, intermittent sun exposure is linked to higher risk of BCC than similar levels of continuous exposure. Okay, or for physical factors such as fair skin, like eye color influence, UV radiation sensitivity, but are also independent risk factors. Ionizing radiation, arsenic, oral, methicillin, procellin, and ultraviolet light exposure, the development of BCC has also been linked to radiation. Okay, immunosuppression makes people more likely to develop BCC. In organ transplant recipient, the ratio 4:1 of BCC to squamous cell carcinoma seen in immune-competent patients is reversed. There were 21 times as many cases of BCC among Australian heart transplant recipients as among Australians who had not received a heart transplant, and 123 times as many cases among Americans who had not received a heart transplant. Renal transplant recipients have a tenfold increase in the risk of basal cell carcinoma when compared to the general population. Okay, the sign of basal cell carcinoma is we can see from any spot on our skin. There are new or changing in size, shape, color should be checked by a doctor. And then any unusual sore, lump, blemish, marking, or change in the way an area of the skin looks or feel may be sign of skin cancer or warning that it might occur. Okay, the area might become red, swollen, scaly, crusty, or begin oozing or bleeding. It may feel itchy, tender, or painful. So everyone must be careful. Okay, for the conclusion, basal cell carcinoma is the most common type of malignant neoplasm in humans, and its prevalence has risen in recent decades. It high frequency places a significant strain on the healthcare system, making the disease a public health concern. Basal cell carcinoma is frequently detected early when it's likely to be easier to treat. The first, you can have skin self-exam, which is knowing your own skin important for early detection of skin cancer. According to the guidelines for early detection of skin cancer, learn the patterns of moles, blemish, freckles, and other skin marks so that you can spot any changes at your skin. And then two, exam by a healthcare professional. Regular skin exams are especially important for people who are at high risk of developing skin cancer, such as who have a weakened immune system or people with conditions such as basal cell nervous syndrome, or we call it Golin syndrome. Okay, that's all from me. Thank you.